You dropped Joe at nursery. Was Jack there?
Who?
He and Joe are good friends, apparently.
Oh, yes. They went off to go and play trains together.
Yeah. They've been building these complex tracks. Pretty impressive, don't you think?
You don't want to know what I think.
There's got to be a spoon in here somewhere.
I was supposed to put that on last night.
Oh, don't worry.
Maybe there's something I was supposed to do before bed.
It's fine.
Get me washed them.
No, it'll only take me a second. Sit down.
You better hurry up or your cereal will go soggy.
Sure how? She shouldn't have to clean up after me.
Yeah, well, I don't mind being mother, occasionally.
You never mothered me. Well, I'm just saying I wouldn't mind is all. And you don't be getting any ideas. You're still cooking for us tonight, aren't you?
Just you wait. It's going to be brilliant.
Who wants to do the honours?
Let's just get this over with, shall we?
Right, well, first on Howard's agenda are GP rotas. According to this, the time that we're putting in, partners included, varies a lot.
Funny how Howard has left us for the one time that he's not here.
Sure we can all stay impartial?
Come up with some kind of point system based on how much and what type of work we're doing.
Now I feel like I'm in school.
Does sound a bit OTT.
Yeah, well, it does vary a lot.
So come on, name and shame.
So much for impartial.
Out with it.
If you insist. Neve's hours are a little down. Al's also. And the lowest is Daniel.
Well, there's a reason for that. Yeah, I did consult everyone about going to Australia, so...
No, you didn't. Anyway, you would have gone with or without their say-so.
Well, I'm happy to pull my weight now I'm back.
As if you need another excuse.
For what?
Do I need to spell it out?
Feel free.
To avoid what's really important. Bury your head in the sand, Daniel, like you always do.
How's your partner's meeting? Oh, good morning.
I'll be at the campus.
What went on in there?
Just get him a notes.
Sorry to barge in, but I really need to see someone urgently.
Oh, OK, but Heston's not in today.
These for me.
He's the only one that knows my dad.
Is everything OK? Is your dad all right?
No, not really. Could anyone else help me?
I can try. I'm Dr. Veer.
Hi.
Maybe we could ask another doctor.
No, it's no trouble. Don't worry.
That's very kind, thank you.
Follow me.
Thanks.
It's hard to explain. The pain kind of moves around.
OK, I'm not sure I follow.
It twinge every now and then.
Right.
Look, I'm not here about me. It's about my son, Freddie Kilpatrick. He's registered here.
OK, is Freddie ill?
I don't know, that's the problem.
Mr. Cunley, I have patience to see.
I'm worried about him. My ex, Sandra's making out that he's sick, and I need to know if it's true.
Well, wouldn't the best thing be to ask her?
It's complicated. We split a few months back.
Oh, sorry to hear that.
You know what women are like. As soon as you leave them, they make your life a misery. Just won't answer my calls. Has made it impossible to see my kid, my own flesh and blood.
You taking steps to get access?
Of course I am, but it takes time.
OK, well, I have to ask, given that your son has your partner's surname, do you have parental rights for Freddie?
What?
I can't disclose any medical history.
Yeah. It's a mad world when a father doesn't get them automatic, like.
Yeah.
You got kids?
Yeah, boy and a girl.
So you'd be freaking out too, right? If someone told you one of them had cancer.
Dad's got motor neuron disease. He was diagnosed 3-4 years ago. Well, it was a big shock for all of us. He was always so active.
I can imagine.
Recently he started getting weaker. His muscles, he needed help breathing.
Who's treating Patrick?
His consultant is Dr. Hopcroft at St Phil's. Do you know him?
No.
Well, I trusted him. I honestly thought he cared about his patients. But this, that doesn't make any sense.
What doesn't?
He's taking Dad off his Riluzole.
That's a drug that helps with neurological symptoms.
It can help slow things down, give people more time.
Right.
I mean, why doesn't Dad deserve the same treatment as everyone else? Is it about saving money? Is he being written off because of his age?
How old is your father?
70. Do you think that's too old?
No. But without speaking to Patrick's consultant
Oh, you lot probably stick together.
and knowing all the individual circumstances...
You can't help me.
That's not what I'm saying.
So you'll do what you can?
Yeah.
Oh, you promise?
Hello?
Sorry to bother you. Listen, I was wondering if you remembered a Sandra and Freddie Kilpatrick.
Not off the top of my head.
They came in a couple of months ago, registered as temporary patients.
Okay, wait, give me a second.
You ordered a blood test for the boy, suspected anemia?
Oh, yes, okay, I remember now. She said that he was under the weather, suffering from fatigue, so I ordered the test just to put her mind at rest. And they came back fine, as I suspected.
Okay, so you didn't have any particular concerns? There was no indication that the boy was more seriously ill?
No!
Okay, and did you check Freddie's record with his previous GP?
Well, I had no reason to. Look, just check my notes, Daniel. They're all in there. And now if you've finished interrogating me, I have work to do.
Could you contact the CCG, please, and request that Sandra and Freddie Kilpatrick's GP contact me urgently?
Yes, yes, of course.
It may help to speed things up if you explain that the boy is only with us temporarily and that it's a child safeguarding issue.
Oh, so good to hear from you. How long are you back for?
Yeah, this is the campus surgery. Yes, we need to find the GP of, well, 2 of our temporary patients. No, do not put me on hold.
I'll be at the mill. Better make the most of it then. Tonight? Sorted.
No. I am not a doctor. I am a receptionist. I have been authorized by Dr. Granger to find this information. It is very important. No, do not put me on hold. This is a child safeguarding issue.
I'm sorry, but the person you called is not available.
Hi, it's Zara. I just wanted to check that you were okay with Joe's meal plan. And if you have any trouble getting hold of rice noodles, just give me a call back, okay? Thanks. Yes?
Sorry to disturb you, but I really could use your advice on something. If now's a good time?
Well, not really. Can't it wait?
Well, I'm not sure. It's about this consultant's care of a patient.
You do remember that you're an F2. Oh, hang on. Hello, could you just hold on a second, please? Is it urgent?
I guess not, no.
Hello, hi. Thanks for getting back to me. It was just a query about Joe's meal plan for this week.
Had to work hard there, like. Sweet talking your receptionist sent to give us another appointment.
Normally she's immune to that kind of thing.
Look, I wondered if you found anything out.
I'm still working on it.
Sandra's been on social media posting all this stuff about Freddie. Photos, stuff about the treatment he's getting.
Does she say what kind of cancer he has?
No. She could still be faking, right?
Why would she do that?
I don't know. She's after sympathy, money, even. Who knows what goes on that woman's head?
Look, I wish I could help you, but the quickest way that you're going to resolve this is if you get Freddie and Sandra to come and visit me.
I can't do that.
Well, why don't you go around to the house?
I don't have the address.
I thought you
Look,
said...
I'm desperate here. It's doing my head in not knowing if he's sick, if he's okay. You've got kids, imagine what that's like.
Yeah.
Freddie's he's always been on the go. He's well into his football. He got scouted last year.
Oh, it must be good.
That's why it kills me to think he's had to give it up. My little lad.
Look, I can't be certain, but I've made some calls.
If there's anything you can tell us, anything at all, please, I'm begging you.
I can't give you any detail, but Freddie may not be sick.
Knew it. You've got to help me.
Mr. Gore's still not here.
No, but Roy Sharp is. You could see him first.
Can I ask you something?
Yeah, if you're quick.
There's a consultant at St Phil's and he's taking a patient with MND off a drug. I'm not sure I agree with him.
Based on what?
Well, I've done some research and...
You know, MND patients have a whole multidisciplinary team in charge of their care, and those people are experts.
Yeah, but they're not infallible.
Yeah, and you still want to wade in anyway. My advice is leave it to the people who know. Mr. Sharp.
Hi there, Dr. Granger from the Mill Health Centre.
What do you want?
Well, I'd like to talk to you, if that's okay.
How do I know that you are who you say you are?
I've got a card here somewhere. There it is. Thank you.
I didn't call for any, did I?
Well, the reason I'm... Freddie! Hello. Not at school today?
He's sick.
Oh, is that right? What's wrong with him?
He's got this thing. It's called, acute leukemia.
Acute lymphocytic leukemia? Yeah. And when was Freddie diagnosed?
A few weeks back.
Right. So you've been to the hospital?
He's having chemo.
Where's that, St Phil's?
No, we're seeing a private specialist.
Okay, well, it'd be good for our records to have their name.
We've been seeing a few different ones. Look, I'm sorry, I've got stuff to do. I've got to get on. You never said why you were here.
Well, the thing is that you only registered with us temporarily. I've been asked to do a follow-up to check to see that everything's okay. Do you mind if I have a quick look at Freddie while I'm here? Good. Okay, Freddie, if you don't mind just grabbing your T-shirt and just pulling it down so I can see the top of your chest.
Look, I'm sorry, you can't come in here just asking questions like this. It's hard enough with a sick kid.
Okay, it's no problem.
I want you to go now.
It's fine. Bye.
Is Al about?
No, he's at a meeting with Eve.
Emma?
She's gone for a sandwich. Anything I can help with? I'm a good listener.
This is patient with motor neuron disease. I'm worried he's been taken off a drug because of his age.
How old is he?
70. But the thing is, when I looked at the research, it was pretty inconclusive. I mean, the drug might benefit some patients, but then again, they may just be believing it's helping.
Right.
But that is part of the battle, isn't it? Keeping people positive.
Yes.
So you agree? I shouldn't let this go. I should have it out with the consultant.
Oh, I'm not going to say that. I mean, shouldn't you speak to a doctor first?
You think?
I think it's good that you care and you want to do the right thing by your patient, and it's not right that you treat older people like they don't matter, so...
Thanks. You've been a big help.
Have I? Or your apple.
Oh.
So there was no indication that Freddie was sick when he was registered with you?
Chicken pox is the worst he'd had. Al's been seeing the boy since he was born.
Right, so you know Sandra well?
She's got a pretty complicated medical history. It's mainly mental health issues, depression, somatisation disorder.
Okay, that might explain what she's doing with Freddie. So I checked, and there was no scar from a central line, no indication, no sign that he's been having treatment.
In which case, it's fabricated or induced illness. That's essentially abuse. You'll need to involve other agencies, get the child removed.
Well, hold on, you said yourself that Sandra has a history of mental illness. Surely she needs support rather than losing her son.
I feel for her, really I do. Especially after the hell that she's been through.
What do you mean?
Domestic violence. That's why she moved from Sutton Vale.
Was this with Ian Carney?
He put her in hospital several times, beat up really badly shortly after the baby was born.
Okay, and does he have parental responsibility for the boy?
Would you put someone on a birth certificate after something like that? I was so relieved when I heard she was moving to somewhere new.
Right.
She's probably got a restraining order, but he's the persistent type.
Ooh, what you got? Oh, just something light, you know. I don't want to ruin my appetite for this evening.
For what?
Well, the meal that you're cooking tonight.
About that.
Oh, problem?
My mate Shaz called me earlier and I just haven't spoken to her in that long that when she invited me out...
It's fine.
I'll call her back.
No, don't. You should go.
Really?
Yeah, don't worry. We can do it another time. I'll just cook whatever you've bought.
I hadn't exactly got that far. I was just going to do it after work. Sorry.
It's fine. Don't worry.
So I'll see you next week.
Okay, thanks, Doc.
Did Ian Carney come in again?
No.
Can I have his number?
Oh, thank you for coming. It has been getting busier and busier.
Students are woken up then.
Okay, so, yeah, he's not answering. I'm going to have to pop out.
Again?
Yeah, won't be long.
All right. There we go. There we are. All right, Dad. You came to help us.
I'll try.
Well, you do see how wrong this is.
Let me speak to Dr. Hopcroft.
It's... Get you sorted, don't worry.
Rob, hi, it's Daniel. Yeah, I need your help with a domestic. Yeah, the guy's named Ian Carney. I've had some dealings with him. He's got a history of domestic violence. Yes, it's 101 Havard Terrace. Okay, yep.
Listen, he's coming with me.
You can't take him. He doesn't even know who you are.
Hey, Freddie. Why don't you go up to your bedroom? Okay, play there for a bit. All right. Ian, let her go.
It's got nothing to do with you.
You need to let Sandra go.
Leave us alone.
Help me.
Okay, listen, why don't we all just sit down and talk things through?
It's nothing to talk about. I'm taking Freddie.
He's my boy.
Ian, you told me yourself how much he means to you. Do you really want him to see Mummy and Daddy like this? That's good. Good, let's just take one step back. That's it.
I haven't finished with you.
Oh, just get him out of here.
I'm not leaving Freddie with that mad cow.
Okay, listen, if you don't want to go, then why don't you just sit down here? Okay? Good. Let's come to the kitchen. Okay.
Michael. Oh, hello, sorry. Dr. Hopcroft? Yes, that's right. Dr. Viznev too here. What? No, I had no idea.
Freddie doesn't have leukemia, does he, Sandra?
He's sick.
I saw Dr. Rush, so please, in your own time, try and explain why.
Because she's mental.
Let her speak, please.
I don't know. I don't know why.
I know you've had a tough time. I understand that.
So sometimes it just gets too much. I love Freddie, I do. It's just sometimes I wish I could just fly away from it all.
Okay, do you want to tell me how it started?
We were seeing Dr. Rush and one day this kid comes in. You could tell he was sick straight away and suddenly everybody was there. It's like people couldn't do enough for him, for his mum.
That's it. That's the reason.
Ian.
She's not right.
Okay. Sometimes people who have suffered abuse need to find a way to cope.
You're making excuses.
Maybe you should think about your part in all of this.
Dr. Veer! I want a word with you.
Really?
I have just had a very irate consultant on the phone. We are closed.
Janet Peters.
I don't care if it's the Pope. Janet Peters.
I need to see Dr. Veer. It's all gone wrong.
I'm Dr. Carmichael. Can I help?
No, it's okay. He's been helping me.
As I gathered. But I am currently mentoring Dr. Veer.
My father's consultant saw me at the hospital just now. He wasn't happy that I'd asked for a second opinion. I tried to explain, but things went wrong.
How wrong?
I'm going to have to move my dad to another hospital.
Well, out of Leatherbridge, that must be a tremendous upheaval.
I know, it's such a mess.
Let me tell you that Dr. Hopcroft is the best MND consultant in this area. Your father is in excellently capable hands.
I don't know what to think anymore.
Why don't you come through to my office and we can have a little chat?
Okay, thank you.
You too.
She'd nag at me all the time. We were always arguing.
So you're blaming Sandra?
I'm just saying, you don't need that. You don't want to come home to all that stuff. She didn't like us having a drink, complain when I wasn't working. So I found jobs away. I wouldn't see them for weeks at a time.
Why didn't you stay gone?
You needed me. Needed a man around.
Did I?
The boy was missing his dad, you can't deny that.
You were only ever a dad to him when it suited you.
I've made mistakes.
You admit it?
I lose it sometimes.
Ian Carney,
You called the police?
you're under arrest for breaking the terms of your restraining order.
No, you can't do this to me.
You don't have to say anything, but it may harm your defence if you don't mention... If you don't want to do that...
Get off me!
All right, calm down.
You've trusted Dr. Hopcroft in the past.
He's always taking time to explain things.
So why doubt him now?
I could tell he was hiding something. When I asked him why he was taking Dad off the Riley's-all, he couldn't meet my eye.
It might not suit him any longer.
Or the NHS to pay for it.
And how is Patrick at the moment?
His last few months he's been getting worse. Needs a chair, help with breathing.
It must be hard seeing a loved one go through these changes.
That drug was a lifeline.
It may have prolonged his life by a few months.
Precious time.
Dr. Hopcroft said to me that he made his decision after speaking with your father.
No, he would have said.
Maybe he didn't find it that easy to tell you.
I don't understand.
Your father made it clear that as his symptoms progress, he doesn't wish to prolong his life.
I don't believe you. Did you know about this?
No. I'm so sorry.
You need to sit down with your father and talk about what's next. You need to make decisions about palliative care and end of life, and Dr. Hopcroft and his team will support you.
I can't. I'm not ready.
It won't be nearly as difficult or as scary once you get started. And the important thing is that your father lives out his last few months with dignity.
Dignity, yeah. Well, that is important to him.
I do know that this can't be easy for you.
I know it's all right. I needed someone to tell me straight.
Social services are on the way.
Any news on any relatives that might be able to look after Freddie?
Doesn't look like it.
What a mess.
Don't beat yourself up. He's safe. That's what really matters. Do you want to wait in the house till they get here? I'll take him back to the station.
Okay.
Yeah.
I've really messed this up, haven't I?
Yeah. Yes, you have. What?
Sorry, I've just seen Jenna. Just wondered if everything was okay.
Dr. Veer, is everything okay?
Daniel just phoned. He's not had a good day. He's gone to pick up Joe.
Oh, great.
I thought that I could help. I thought that I was doing the right
I'm sorry,
thing.
what? What did you hope that you could achieve? By putting doubt into Janet's mind, you have caused her unnecessary anxiety and grief. Your job was to help her to understand what was happening with her father, but instead you waded in thinking that you knew best.
There was all this different research about the drug.
Okay, let me spell this out for you. Today you have succeeded in making an unspeakably bad situation unspeakably worse. You have wasted my time, you have wasted a busy consultant's time, you have wasted the time of a dying man who hasn't got much time left. All of which proves that you are both brainless and utterly incompetent.
He's as deaf as I'm blind.
I hear perfectly well.
You rude old pig.
Are you suggesting that I don't love John?
No.
Then what do you mean, you care more?
Do you recognise this man?
You look deep into my eyes, and you'll see your fortune.
We're heading to the Chelsea Flower Show again in an hour.